Morning, everyone. Welcome to Onward New River Valley Spring Investor Live Stream. My name is James Cavler. I'm the Director of Business Engagement for Onward New River Valley. And we want to thank you again for taking time out of your morning to join us today. Whether you're at your home or your office, we hope you are enjoying your favorite morning beverage. We would like to first recognize our chairman level investors, Montgomery County, Pulaski County, Virginia Tech, and Carilion New River Valley Medical Center. Our president level investors, Floyd County, Giles County, City of Bradford, Atlantic Union Bank, BAE Systems, Block 1, Celanese, and Lewis Gale Hospital, Montgomery. We'd also like to thank all of our investors that invest in our mission, because without you all, we wouldn't be able to put on quality programming like we are doing today. So thank you for investing in Onward New River Valley's mission. You truly make the organization move forward. We would also like to recognize our new investors that we've acquired recently. We have Whiting Turner and Wing. So welcome for being an investor. And for those of you all that are viewing that are not an investor, feel free to reach out to me. I'm happy to discuss that with you. We'd also like to thank our event sponsor, ServPro of Roanoke County, Montgomery County, and Pulaski County. And featured here, we have our local business development coordinator, one of them here at New River Valley, John Tuttle. He's a business leader here in the community. I'm sure most of you are familiar with him. But for any of your fire, water, or restoration needs for your home or business, please make sure to reach out to John. And ServPro can also help you with any type of COVID-19 related cleaning or issues. So make sure to contact John for that. And now we have a special message from our event sponsor, ServPro.
At ServPro, your worst nightmare is our everyday job. We are faster to any disaster. We have 32 nationally certified technicians, exceeding all of our competitors. At ServPro, we pride ourselves having the most powerful and state-of-the-art equipment, from carpet cleaners, washers, dryers, ultrasonics, and hundreds of our air movers and dehumidifiers, which is why our 4.7 out of 5 average review scores makes us a leader in the industry. ServPro, making it like it never even happened.
Good to see you today, virtually, of course. My name is Charlie Jewell. I'm the Executive Director of Onward New River Valley. And before we get to our keynote speakers today, I wanted to give you an update on Onward New River Valley and how your investing is making a difference in not only our organization, but our region. But before we get to that, I want to take you back about a year ago. It was interesting. I was watching the nightly news last night, and they had recently done a contest where they asked people to send in the last photo that they had on their phone before everything shut down. And as I thought about that, I was like, wait a minute. The last thing that I did in terms of a mass gathering was actually our spring investor event 1 year ago this week. And it is likely for a lot of people in this picture, it was your last mass gathering since the pandemic began. We've certainly faced our fair share of challenges over the past year, but I think hopefully we're on a path of better, greener pastures, and looking forward to our keynote speakers today to share with us the efforts within the New River Valley to hopefully get this pandemic behind us. We do hope at some point this year to return back to in-person events. Our next quarterly event would be in June. So we're going to be evaluating that, whether it's a hybrid event by that point. But then with our annual dinner in September, we're really, or at least I am very hopeful that we'll see a scene like this again. But we'll just have to wait and see. But thanks for your patience over the past year as we've had to go virtual with these events. But know that when the time is right, we look forward to seeing everyone in person again. So I wanted to give everybody an update on the 5-year strategy. So the Onward 2023 plan. We're officially halfway through the 5-year strategy. So at the end of December, we actually surpassed 30 months into the 60-month plan. So currently, as we sit here today, we're a little over 32 months into the plan, so roughly halfway. As a refresher on the plan, it's primarily comprised of 3 goals, and they're overarching. So goal 1, everything we do there is focused on attracting and growing industry to stimulate new jobs and investment in the region. So the industries that we focus on are advanced manufacturing, IT and software, food and beverage processing, and agribusiness, and also unmanned systems. Goal 2, everything there focuses on talent. So we want to attract and retain talent to support regional growth. So we focus primarily, when we talk about talent, we want to see the communities around the New River Valley see healthy population growth, but we also want to make sure that we have the talent needed to support goal 1. So within those industries, we focus on trying to make sure and promote that we have an adequate workforce to support the growth of our targeted industries. And then the 3rd goal is really around placemaking. So how do we develop a regional brand so that people recognize the New River Valley and people locally identify with it? But then also we know that there are certain assets that we need within the region in order to be successful at recruiting new companies or people to the region. And that's where it really takes a collective effort of the entire region in terms of localities to the private sector to higher ed to K through 12. That's the region being the region and producing a region that supports economic development. So our progress report, I actually included this in our monthly update, which is the Investor Insider that was sent out earlier this month. There is a presentation in there that goes through all of our metrics. It talks about all 44 individual initiatives. You won't be able to see this here, but I wanted to bring it up because it is available to you in the Investor Insider that was sent out. But it really details the progress that we've made executing all 44 initiatives. And so as we look at that and evaluate that, currently of the 44 initiatives, we're 75% of those are on track to achieve the 5-year goals. 16% have made substantial progress, but we're not ready at this point to say that we're fully on track because we still have a little bit of work left to do to get there. 2% is we're currently not on track, but we continue to work towards that. And then 7% we haven't actually started yet. And just to provide some perspective on this plan, this was a bold, new redefining of Onward New River Valley in the plan. So all of the talent stuff in goal 2, none of that was part of our initiatives prior to the 5-year strategy. And then we've added some things to the industry side. So there was a lot to launch and actually get going through the plan. So at 2.5 years or halfway through the plan, to be at 75% on track and then another 16% to be within reach, I'm really proud of those numbers for the organization, and I hope you are too. I'm going to take some time to actually walk you through some of the milestones that have been accomplished through the 5-year strategy. So goal 1, of course, is industry. One of the main things that we do there that we've done since the very beginning back in 1990 is lead generation and working to attract new companies to the region. So on that front, at 2.5 years in, we've executed 38 different marketing campaigns, whether it's outbound travel, inbound, or this year, unfortunately, we've had to do a lot of virtual, but we've still been able to see some success with that. We've been able to generate up to this point 102 prospects, new opportunities for the region that we've been able to work with our local economic development offices around the region in order to try to get them interested in locating in our area. 32 of those have visited the New River Valley. 11 have actually progressed to the point where we're pulling together proposals, or not us, but the locality and the state are pulling together proposals for those. And we've had one to date, we've had one new company that we've supported located in the region, and that was Patent Logistics with Virginia's first industrial development authority in Pulaski County, ultimately landing that project in New River Valley Commerce Park. Another thing that we've started, product is extremely important. And when I say product, sites and buildings are extremely important in the site selection process, particularly on the industrial side of the house. We have launched to date 4 videos that showcase available sites and buildings in the New River Valley. These, the ones that are showing now are the ones that we've produced, but we're releasing those through email marketing to our list of site consultants across the country. And then we're also doing postcards, going a little old school, where we're doing virtual tour postcards where we have QR codes where they can actually scan it, and then it'll automatically pull up the video of whatever property we're marketing at that point. We're only about halfway through. We have a couple others in process right now that we're producing, but we'll ultimately have 10 videos likely within the next 6 to 8 months total that we'll be able to use to market the entire region. I can't explain enough how important marketing tools like this have been in the pandemic while everything has been virtual. We launched under Goal 1 Industry, our Industry Leaders Summits. So part of the 5-year strategy is not only to try to recruit new companies to the area within our targeted industries, but we also want to be, we want to help those industries in the New River Valley be as competitive as they can be. So we launched these industry summits as part of the 5-year plan, where we actually convene meetings of leaders in the tech sector, and then we also convene leaders within the manufacturing sectors in order for them to talk about what the challenges and opportunities are for their industry. And we've been able to bring in subsequent programming in other summits where we try to leverage and pull in resources throughout the region that can help support them. That not only helps those companies hopefully grow within the New River Valley, but it also helps us understand what the challenges and opportunities are within those industries, so that we are as efficient at trying to recruit new companies in those industries as possible. We worked diligently on telling the story of those industries. You know, within the New River Valley, we want, or not just here, but abroad, we want people not only to think of the New River Valley as a beautiful location with mountains and rivers. That's certainly part of our brand. But we also want people outside of the area to know us as a hub for our targeted industries. So we've actually gone as far as to develop specific messaging for each of our targeted industries. And we're building out a ton of different marketing assets to be able to tell the story of those industries, so that, you know, if it helps us, again, convince companies that aren't here that it is a great place for their industry, but it's also helpful when people may be looking to taking a job here in the tech sector or manufacturing sector to know that we're not just a one-horse town, that there are a number of different companies throughout the region that if they relocate here and it doesn't happen to work out with that, that employer, that they'll be able to find another job. So we've built out, I think I advanced too far. So we've built out other marketing materials to actually tell that story, whether it is targeted industry pages or actual videos for the manufacturing and tech sectors. And those are all on our website, and we use those extensively to tell the story of industry. We're also telling on the talent front the livability story as well. So we have a certain pitch to industry, but then we also know that people who are looking to move here don't necessarily care about, sites and buildings or things like that. So we've developed community pages for each county and city within the New River Valley in collaboration with them to help tell their story as we generate traffic to our website. And then we've also developed 2 videos to this point, one a livability story that's showing on the screen here, and then also an outdoors video as well that we just released last fall, because that's such a part of why people are attracted to the New River Valley. We've started promoting jobs within the region as well. So we want to market the New River Valley as a great place to live, but we also want to help them connect to job opportunities once they get to our website. So we launched a job board a year ago, and it features jobs in a number of different occupations within the region. And we levy those through Indeed. And then we've also focused directly on our targeted industries. So we've launched videos in manufacturing and then also tech, where we went in and interviewed people that actually work for local companies to learn why they chose to consider a career path in that industry, and then also why the New River Valley, why did they come here? These are 2 of the videos here, again, that were produced. The Tech Jobs video was actually recognized with an award through the International Economic Development Council last year as with an award of excellence. And we hadn't released the manufacturing jobs video yet, but we're looking forward to hopefully getting an award for that one as well. We've conducted the brain drain study where we wanted to better understand with the higher ed institutions within the region, what are students' perceptions about sticking around the New River Valley post-graduation. We found that among Virginia Tech students through our survey that only 5% of students at the time said that they were thinking about looking for a job in the New River Valley. 18% of those were unsure. At RU, it was a little higher at 19% said that they would consider staying in the New River Valley looking for employment, but 12% also said that they were unsure. We felt like those numbers were pretty low considering these universities are in our region. So part of the plan was to launch the NRV Experience Program, which is an internship support program for employers to help convince their interns to essentially stay here post-graduation and stick around in the region. So we launched that last year. We had 17 enrolled during a pandemic. We anticipate that number growing this year. We're hoping to hit 50 for this summer's cohort. But the most impactful part of the program was that the chart here shows that pre-NRV Experience, when we surveyed them, it was 50-50 for the interns, whether they were planning to stick around post-graduation. To the right there of the graph, after the NRV Experience, it actually increased to 69% said that they would now consider staying in the New River Valley post graduation. So looking to build upon that, and hopefully we'll have more folks from the university sticking around. And lastly here, placemaking. So we've worked to grow the New River Valley brand outside of the New River Valley. through crafting 353 blogs to tell the story of the NRV. We've reached our posts through social media, have reached more than 2 million people over the last 2.5 years. And with that content that we've posted, 117,000 people have liked or shared or commented on our content. So it's getting recognized and it's resonating with people. Through that, we've been able to double our social media following across all platforms from 6,000 to over 14,000. And our website traffic has hit 152,000 visits during the plan. And we've grown from pre-plan at 20,000 visits a year. Now, last year, we were up to 80,000 visits. And then our videos across all fronts with the 5-year strategy have reached 500,000 views, which is a great number to hit with 2.5 years. And we're going to continue to grow those numbers. Lastly, here, I just wanted to give you an update on the NRV recovery. As of February of last year, that was kind of the pre-pandemic number. There were 78,500 jobs in the New River Valley. From March to May, we sustained job losses totaling 12,500 jobs, or 16% of employment in the New River Valley due to the pandemic. But by the end of the year, by the end of December, we had regained 60% of those jobs, or 7,500. But we still have a ways to go. As of the end of December, which is the most recent data that has been released, we had 6% fewer jobs in the New River Valley than we did pre-pandemic. So we're still 5,000 jobs off from pre-pandemic. And I've been getting a lot of questions about, well, when will the rest of those jobs return? We did our competitiveness survey this past fall, where we surveyed tech and manufacturers in the New River Valley. They all seemed like they were anticipating job growth within the next 12 months. But I think a bulk of those jobs have already returned at this point. But we know that the service sector, whether it's restaurants, lodging, hospitality, has not been able to get back to business as normal. So the one thing I think that will influence our number there and help those jobs return will be our discussion today and the work that Dr. Bissell is doing and others in the New River Valley to get as many people in the New River Valley immunized with the vaccine. And at that point, physical distancing restrictions will start to be lifted. And then hopefully we can generate enough demand again to support those businesses at pre-pandemic levels. So optimistic, and this is where I'll hand it over to the public health official to hopefully help give us some insight on how things are going in the New River Valley. Dr. Bissell is the health director of the New River Valley Health District, one of 35 districts within Virginia Department of Health. She oversees the health departments in approximately 55 staff in 4 counties, including Montgomery, Giles, Pulaski, and Floyd, and the city of Radford. And at this time, I would like to invite Dr. Bissell in to update us on the distribution of the vaccine within the New River Valley.
Thanks so much. Good morning, everyone. Thank you for having me join you. It has been quite a year. I remember the last time I joined you was at Sinklin Farms outside over the summer last year, and we had a very nice outdoor meeting. I think you're right. Vaccines are the light at the end of the tunnel and the way to end this pandemic. And when we think about it, vaccines are a pretty big miracle of science. It was less than a year from when we had the genomic sequencing of this virus to where they introduced the vaccines. And they didn't cut corners. They went through and cut out a lot of the bureaucracy, but the science is still there. The clinical trials and the safety trials were still there. So we have some very effective vaccines right now, which is just a tremendous asset to have during a pandemic like this. As everybody knows, 2 of our vaccines are the mRNA technology, which is a new vaccine form, but it's not a new technology. They actually were getting ready to use these with the last SARS pandemic, but then the pandemic actually kind of subsided on its own and the funding sort of dried up to try them. But they've been using mRNA for other things in science with medications and chemotherapy. So it's not a new technology. And two of our vaccines are the mRNA. One of our vaccines is a more traditional viral vector vaccine. The good news is that all three vaccines are very, very effective. I know the media has given a lot of coverage to the Johnson & Johnson, the one dose being a little bit less efficacious in preventing disease. People have to understand that these trials were done on different populations in different geographic areas using and people had different strains of the virus circulating at the time. But the biggest thing to keep in mind from a public health standpoint is that all three of them are equally effective in preventing severe disease, hospitalization, and death. And that's really what we're looking at right now. We started vaccinating our nursing home populations early because they were our highest risk. And we're seeing no more outbreaks in our nursing homes. So that's just proof that the vaccinations are working. And as we're saying, the best vaccine to get is the one that you get. Obviously, the demand at this time still far exceeds the supply, although we are very hopeful that in the coming months, the coming weeks to months, that's going to change. So we kind of had a parallel rollout of the vaccine. We wanted to take care of our highest risk individuals. That's our folks in our nursing homes, congregate settings, the elderly with medical problems, and those who have chronic medical conditions, because we know they're the people that suffer the most. They're the ones at highest risk of hospitalization, ending up in the intensive care unit and dying. But on the other side, we had to vaccinate the people keeping our infrastructure working. That's our healthcare workers, our frontline healthcare workers who never stopped working during this pandemic. It's our emergency medical services personnel, our law enforcement, our fire folks, and then those critical service folks and government that kept things running during the pandemic. We couldn't shut things down. So we've kind of had a parallel path there to get all of those people vaccinated. I will say that in the New River Valley, we have had over 58,000 people who have been vaccinated. That's about 32% of our population. Over 36,000 of those have been given by the health department. And then over 17,000 of those have been redistributed to our pharmacy partners. We have some very good pharmacy partners who've done a wonderful job getting vaccine out to our communities. And we've also redistributed to some of our medical practices to get their patients taken care of. We have over 23,000 people who are fully vaccinated in the New River Valley. That's about 13% of our population. So that means people who've received 2 doses of the Pfizer or Moderna or the 1 dose of the Johnson & Johnson vaccine. When we look at the prioritization groups, we had the 1A, which was our healthcare workers and our nursing home folks. Then 1B, we got into more of our critical infrastructure, our 75 and older, and we also get the 16 to 64 with medical conditions. 1B alone is half the population of the New River Valley, half the population of Virginia. So in the New River Valley, that's about 90,000 people. We, up to this point, have only been getting about 2,000 to 2,100 doses a week, other than some occasional boosts that we've gotten. Like, for instance, last week, we got a large quantity of Johnson & Johnson of about 5,000, but we're not going to get any more Johnson & Johnson for a few weeks. So we have done our best to get the vaccine out there as quickly, as efficiently, and as equitably as we can. We've asked for a lot of patience as we've done that, because as we've said, we just don't have enough vaccine that we can vaccinate everyone who needs it or wants it as quickly as they do. We are expecting by the end of March and into early April that supply is going to increase significantly. Up to this point, when we first got the vaccine before the holidays, we started just doing it at the health department. And then Blue Ridge Church graciously gave us their facility to enable vaccination. And it's been a wonderful facility. where we've been able to bring a lot of people through. People are protected from the weather, being indoors, which is critical over the winter when you're trying to do the most ambitious vaccine rollout we've ever done. But we are outgrowing this site, and as more vaccine becomes available, we have to have some sites where we can really bring several thousand people through in a day. So the Dedman Center is a place that we've used, and we were very successful with a large scale effort. Blacksburg High School was a place that we used a lot for our testing. It too sets up very well to have a very large scale event. And then we have some other church venues who've been have been very gracious to volunteer, and we're working on logistics of how we could use those as well. So we're going to kind of change our plan up a little bit. We had been vaccinating every day. We're going to start vaccinating our large scale events on Tuesday, Wednesdays, and Thursdays. And then we're going to start doing more targeted outreach vaccination events on Fridays. And that's going to be important because as the vaccine supply opens up, we definitely want to make sure we can still host those large scale events, but we also want to make sure that we're getting it out to the people who don't have as much access, and that we can spend a little bit more time with. If they have more questions, they need a little bit more education. I mean, when we think about vaccinations, they're one of the greatest public health inventions that we have that have made a huge difference in public health. And this one's no different. So we really have to work to making sure people understand it. There's a lot of people who just have questions because it is one that came through very quickly, and we do have some new technology. The other thing we're working very hard to do is bring on more of our federal partners. There are two different pots of vaccine right now: the state allocation, which is what I distribute to my community partners, but then the large scale pharmacies, the Walgreens, the CVS, the Krogers, those are through a federal partnership, and we're trying to bring more of them on board because, as we know, as that supply opens up, we want people to be able to go into a pharmacy and get their vaccine. So we're working on those relationships and at the state level and at the local level to make sure we can ensure that as the vaccine becomes available, that it is distributed through the New River Valley so that people in the New River Valley have access to it, easy access to the vaccine. The vaccine is federally covered, so there is no payment. You are not charged for the vaccine. If you do go to our pharmacy partners, some of them will charge an administration fee to insurance companies, but no individual is supposed to be billed for the vaccine at all. So this is a free vaccine to everybody, and we need to make sure that we have access to everybody. So I think that's pretty much it for my update.
Thank you, Dr. Bissell. Sorry for the little delay there. We still struggle with the virtual stuff a little bit, as with everybody. Yeah, thank you. Sounds like you guys are really doing a lot of great work out there, and certainly we appreciate everything that you and your team are doing to get us all back to normal. I hope you'll stick around. I think we have a couple questions that were submitted from our investors that we'll ask you through the Q&A. At this time, I'll transition over to Jim Cowan to talk a little bit about the role of employers in vaccines. This is something that we're hearing a lot more about throughout the region. It's just, from employers, what can I do? What can I do? There's a lot of legality things there from an HR perspective. So we wanted to invite Jim Cowan in to help brief us on that. Jim Cowan is the chairman of Cowan Perry PC. He has 25 years of trial experience representing employers in non-compete litigation, myriad types of business and partnership disputes, and the waterfront of employment-related litigation, including employee benefits and ESRA claims. And I believe we have Jim on now. How are you doing, Jim?
Good morning. Very well. Thank you. Appreciate it. Excited to be with you all this morning. First, I'd like to thank Dr. Bissell. We work with employers across the state, mainly, manufacturers, community banks, folks in healthcare and all these industries. And I have to say, they've done a better job here than almost anywhere else, from the communication from their staff to where we are as far as what percentage of the population that we've been successful in getting vaccinated has just been fantastic. So really a huge thank you to them. I think people don't realize just what a phenomenal job they're doing sometimes. So I want to thank them for that. As we jump in, my thought would be to talk a little bit about the top questions I'm getting from employers and some of the takeaways from these regulations. The EEOC issued some guidance out there to employers in the area of what kind of you can and can't do, and how they're going to look at employers that want to recommend, require vaccination, and how that works on bringing their workforce back into the manufacturing plant, the office environment, whatever it may be. So these regs get out there, but like with many things, there's things you can do, but that doesn't always mean you should do. And I tell folks that because the main thing that we've seen from these regs that's jumping on all the headlines is this question of, can an employer mandate? Can I require that my employees become vaccinated? And the answer from this EOC guidance was that generally, yes, you can. But like most legal things, most government regulations, there's a big asterisk on the side of that says with a couple pretty big caveats. And my comment to folks is, just because you can doesn't always mean you should. And certainly there's businesses and environments where we do recommend it. So we thought we'd talk a little bit about that and the questions I'm getting most frequently, and then we'll open it up and excited to hear your questions. So in looking through this, one of the questions I get is that idea of, well, gosh, can I require an employee? We're starting to maybe have some folks come back in. I've got a lot of employers planning, I think optimistically, for later this spring to try and come back, maybe not 5 days a week, maybe not everybody on the same day, but folks trying to get back that have stayed mostly remote to get back into the workforce, or manufacturing plants where they're trying to get folks back in. And then in industries where they are high risk, if you're in the healthcare or retirement community, can I require an employee to show me proof that they've received the COVID-19 vaccine? Can I ask to see their card that they get, or some proof from their doctor? And the answer is yes, you can. And you can make that a requirement of their coming back into your workplace if you'd like to. And the caveat there is that card itself and that question about vaccination, they've determined and said they're not going to consider that to be a medical exam or kind of this confidential medical information that's covered by HIPAA and all these things, just this idea of whether they're vaccinated. Kind of like you can require an employee to submit to a drug test or to give you the results from that from some third-party vendor. Problem is, if you go past that, you're kind of outside of that. And so if you start asking, well, why didn't you get the vaccine or that sort of thing, that's probably a pretty problematic question, because that could get into all kinds of things like about disability and those types of things. Can I delay and tell folks, as soon as you're vaccinated, we'd like you to come back to the office, but we're going to delay it and have you continue to work remote till then? Sure, nothing wrong with that. Can you encourage employees? Say, we recommend this. We want to get everybody back, and we think the safest way to be back and working together is to get vaccinated. Certainly, great idea. And the only caveat there, of course, everything today comes with a caveat, is you can't retaliate against people who, for whatever reason, don't. If you have a policy where you're kind of recommending that people do this. The same goes for incentives. I've had a lot of questions about folks of, well, can I provide an incentive? And I've got some employers that are applying either a monetary incentive, an extra paid day off if you go get vaccinated. We're seeing all kinds of kind of creative things people are doing to kind of encourage their folks to get vaccinated so they can kind of work their way back towards normalcy as quickly as possible. Or if they're already back in a manufacturing environment, continue to reduce that risk. And maybe we're going to have a clinic, and we'll talk about that for a moment. So can you do those kind of things? Absolutely. If that benefit starts to become really significant, though, or something more meaningful than a $25 this or lunch or some of those things, you do need to think about, well, what about the person who has a medical condition that prevents their getting vaccinated? You don't want to be discriminating against those folks. So is there some out? Do you need to have some conversation with folks who say, well, wait a minute, gosh, I'd love to have that benefit, but because of a medical condition I have, I'm not recommended to be vaccinated right now. Well, what do I do with that person? And so you want to think about that when you put those incentives in place. And then, of course, the big one that started a lot of this conversation on the employer side is this direction that the EOC is saying that you can require that your workers get vaccinated. And a lot of people saying, is that right? Can I mandate it? Can I say everybody's going to get this done? We're going to get back. We really want to get back to normalcy. And the answer is yes, but there's two kind of huge caveats. And that is when you start talking about vaccination in this place, you have two things you have to look at. One are what are called ADA accommodations, which is the Americans with Disabilities Act. And that protects folks that have a disability from discrimination in the workplace and hiring terms and conditions. That's the statute that you provide a reasonable accommodation to an employee who may have a disability that they need some help in their work environment, right? They need to move their office downstairs because they have a mobility issue and there's not an elevator, other types of accessibility things that people may have or accommodation they may need. They may need time off due to a health condition or those sorts of things. Well, that same set of rules applies in this context of vaccination. And so if you decide to do a mandatory vaccination program, you're going to have an interactive process. You're going to have a policy. You're going to have some system in place for how you deal with folks and tell folks that they can come forward and ask for an accommodation if they have a concern. Now we get into the gray, right? All of a sudden, very quickly, well, what's a disability? And I can tell you in most lines, outside vaccination aside, what type of health conditions are going to be a disability. Major impact on life function. It's a very broad list of things that medical conditions that left untreated would render the employee unable to work. Interferes with major life activities like self-care, those sorts of things, all kinds of stuff. But then we get into the vaccination rule where we have what? We have this guidance out there of folks that are at higher risk of COVID, right? Higher body mass index or BMI or obesity or high blood pressure, all kinds of conditions that are very prevalent in your workforce are on that list. If you go down, what makes somebody a high risk person? Well, do all of those people, are those same things kind of disabilities? Well, they're not really looking at the same thing, right? I can have those and it doesn't interfere with my ability to do my job. So it's not the same analysis. You need to be thoughtful about that. But you better have a process to deal with that. And you better be prepared to kind of manage that and do that in a careful way. And that's supposed to be what's called a flexible interactive process that has communication with you and the employee done in a confidential and appropriate manner. To do that and require it, you have to show a business justification. And that, that you can do that by showing either in a meatpacking plant or a retirement community where these are very high risk environments where there's been a lot of transmission. Pretty easy to show that having someone not vaccinated in that environment creates a high risk of infection or disease to others. And the government's come out and said that COVID is that kind of high risk thing that gets that sort of analysis. But what about somebody who's working in an office where they really can follow all these separation and distancing guidance that's out there from the CDC and mask and use sanitizer and do other things? Is that same analysis there? And so if you decide to do it, you got to look at that issue. Is it everybody? And I've got a lot of employers that are saying, well, we may have some groups that we think are in that critical thing, where actually because of their interaction with folks, there could be liability for us if we don't, right? And so we're trying to manage that, kind of these frontline workers that Dr. Bissell was talking about. If I'm a retirement community, I'm probably going to mandate it. But if I'm in an office environment, that ADA analysis of an accommodation, can I do that? And that accommodation idea is that if you can accommodate them without undue hardship, and they qualify and have a medical reason for not wanting the vaccine. Not just a generalized, I'm concerned, I'm scared of vaccine, I'm an anti-vaxxer, I don't think there's enough proof of safety. That doesn't get you there, but some actual medical issue that causes a legitimate concern. An example of that I've had come up with some folks is pregnancy. There's not a lot of data out there yet about safety and pregnancy, and obviously folks are very concerned about that. What do you do with that person? And so, it's hard to say that somebody that's been teleworking effectively for a year can't continue to do so without a vaccine as a reasonable accommodation if they're in one of those higher risks, that they're in a group where they have a genuine medical issue about that. You got to think about that. Could they continue to follow the same protocols that maybe you're using now? Maybe they mask. Maybe when other folks are meeting in a conference room, they don't, and they remote into that. So are there things you can do that aren't an undue hardship on the business? Some jobs you can't avoid it, right? If I'm caring for an elderly person in an assisted living facility, I'm going to have contact with them. I can't do that remotely from another room. And so when you get into mandating it, you've really got to look at all those issues. And then what are you going to do if they say no and they're not in that bucket? Are you really going to terminate an employee or want to terminate employees because of that concern? Big question mark there. If they have a medical or some, if they qualify under this medical piece, they might be entitled to FMLA protections or other things if they're unable to do their essential job functions remotely. So lots of things you get into when you start kind of talking about that issue. The other thing that's out there that you have to address is sincerely held religious beliefs that prevent someone from wanting to take a vaccine in this situation. Similarly there, you have to go through an interactive process to determine if there's that same type of accommodation to let them do their work. The other interesting one that we're starting to see pop up is all of these vaccines are out now under what's called an emergency use authorization, meaning that the FDA, because of the COVID crisis, has authorized them in that way, and they've not gone through this other process. Well, several of those actually have notations about that. If you look at the fact sheet for the Pfizer BioNTech vaccine, it says explicitly, quote, the recipient or their caregiver has the option to accept or refuse the Pfizer BioNTech COVID vaccine. And I think those directives, those comments are meant to maybe protect the pharmaceutical company a little bit, and really more directed whether a government could kind of require, enforce, or something like that versus at-will employment where a different set of rules. But people are seeing those things and saying, well, wait a minute, well, what about this? The EOC's view is that doesn't change these rules that I just talked about, but I think we're seeing that come up, and somebody could have a kind of a genuine kind of concern kind of about that. So you want to be thoughtful about how you handle folks like that. So I think that's an interesting issue. The other last thing I'll mention is this idea of, if you're doing it, if you're mandating the vaccine, perhaps maybe for a group of employees that you've identified as being appropriate to require it. Now, when you're doing that, that's probably compensable time. The employee goes to the Dedman Center one day to get their vaccine. That's going to be considered work time that if they're an hourly employee, they're going to have to be paid for. The other question is, if you do it, you get into a couple other issues. One, well, what if they do have a reaction? They've been exceedingly rare, but there are some. That might be a covered workers' comp type of issue if somebody has an issue. Just like it could potentially be if somebody was exposed and got COVID at work. So you think about those costs and how that works. On a recommended program, you really don't have that same issue. What about doing it on site? We've got some employers that are larger that are bringing folks on site. Can you do that? Sure, helps on that cost and timing, and I think participation levels where we've done that have been higher. So that's a good thing. When you do it in that context, you need to be careful about the questionnaire and the medical, because that other information test is confidential, and making sure you're doing it in a way that kind of protects that. And then we have this idea of, well, when should I cross this bridge? And my answer for a lot of employers is the best way to deal with an elephant, right? How do you eat elephant in really small pieces? And our advice to a lot of clients is, look, the vaccine's not widely available yet, so I don't know that we need to go out and start doing things that are going to create this anxiety in this. Let's see what we can voluntary standpoint and look at this when we get closer. And maybe we're identifying a group that's high risk, that it's going to be mandated, and work through that with those folks. Maybe we're going to recommend and encourage it for other folks. Maybe we're going to use it as a criteria to come back into the office. And let's whittle that group down and get further along. People may become more comfortable with the vaccine as more people have it, and they get more comfortable that it's safe, right? And then that stress dissipates a little bit. And the environment may be different, right? If COVID has really subsided later in the year, the risk of having somebody maybe continuing to use precautions who's not vaccinated, and whether you can accommodate that medical issue may look a little bit different. So the challenge of moving forward and getting a fully vaccinated workforce may be easier as we go down and kind of get into that part of the program. The last question that I get a lot is people that are excited about this, right? Well, once I get them vaccinated, we can all get in the meeting and we're good to go, right? The CDC has come out and said that, right, if we have a group of vaccinated folks, we can sit in close proximity, we can get in the conference room and actually have a lunch or have a meeting and not mask. And they're excited about this at work. And I got bad news for you there. As of now, the most recent OSHA guidance is no. Even after vaccination, we don't know for sure whether people could still get it and potentially transmit it to that person that hasn't, that might be at higher risk, and there's any spread there. We have questions about how long it'll last and sort of those sorts of things. So the current OSHA guidance is that you should still be taking some of those other precautions in the workplace for now. That guidance, I think, may change some over time as the pandemic hopefully subsides, assuming we don't get some other variant that pops up. But Right now, the recommendation from OSHA and from the state is that you should keep those COVID response plans in place and continue to keep up that safety. Now, do I get real worried about 2 vaccinated employees being in an office having lunch? I don't. I have some confidence in the vaccine and how that works. But from a policy company-wide standpoint about masking and some of these other things, I think the guidance is don't all rush back into the conference room. So what the majority of my clients, what are they seeing? That's kind of the last question I always give. Well, what's everybody else doing? And I would say almost all say they plan to recommend, potentially incentivize, but the majority, I'd say at least probably 70% is saying we don't have plans to mandate it at this point. Maybe that changes later, but for now, we're going to recommend. And a lot of that is we've tried to create a culture of trust. We've tried to maintain teamwork and all these things as we work through this. And we really worry that mandating it for everybody outside of a safety sensitive role, everybody understands if you're working with the elderly in a nursing home that you're going to have to, that's a different risk analysis. But in the general kind of office environment, you know, they're concerned about that. There's some concerns about legal liability, but I'll tell you, I get a lot that say we'd really like to mandate it, but we're really worried about a public backlash against that or adverse to kind of a public relations nightmare, issues with employees or creating all of this. And we're not sure that's worth it. So we're going to wait and see. But if everybody else started doing it, boy, we'd probably get on that bandwagon too. So I see them looking at it that way. And then I see people identifying what are those real high risk roles and where do I fit kind of in this. So I tell folks that's probably a good place to be. Vaccination supply is still a little bit limited. I think you go through when you're able to get in with the Newberg Health District and do that voluntary, do a program where you can get your employees in and they get to your group or your employees can go, encouraging that wonderful idea. And then maybe let's see where we are, because you do have to balance that idea of the safe workplace with all these other rights and some of the things that come along with mandating it that you need to be prepared to deal with. And so I think balance in all that is there. I've certainly got some industries where it is going to be mandated and others where it's not. And I think it's going to be hard to kind of force those mandates. And I think that balanced approach probably makes a lot of sense. And I think folks who are effectively telecommuting or working with precautions in place now, it's going to be hard to say that those aren't a reasonable accommodation to somebody that either has a genuine religious belief or a medical issue or pregnancy or some other complication that prevents them from wanting to get the vaccine right now. So those are the 10 questions I get the most done in pretty short order. And with that, I know we were supposed to try and save a little bit of time for questions. So I will turn it back over to Charlie and see if we have any questions.
Yeah, thank you, Jim. We'll pull Dr. Bissell back in. We do have a couple moments left here to answer some questions that some of our investors had submitted when they registered. I'll start off with you, Dr. Bissell. What has been the most challenging aspect of acquiring enough vaccine to meet local demand?
So, I mean, it's just the vaccine supply, right? I think everyone was following the media that they were actually producing the vaccine before it was approved. And so we did get shipments right after the vaccine was approved. By and large, most of the initial shipments went to our federal partners, the CVS and the Walgreens that were vaccinating in our nursing homes. And again, those are our highest risk populations. So they got a large amount of the initial supply of vaccine, and then they started getting it out to the local health departments and the hospital systems to start vaccinating people. But again, that's the most frustrating thing is the allocation is based on population, and you know I'm getting just over 2,000 doses a week, and doing our best to get it out there as quickly and as efficiently and as safely as we can. And we just have to have patience. All three of our producers, Johnson & Johnson, Moderna, and Pfizer, are ramping up their production, and they're telling us in the coming weeks that we should have a couple of 100 million doses. And then we'll be at a place where there is enough supply to meet that demand, and we want to just get it out as quickly as we can.
All right, thank you. And Jim, based on what you've seen with the employers that you've worked with, what's the best ways you have come across to incentivize employees to get vaccinated?
It obviously depends a little bit on the business. I've seen a lot of folks saying, "Hey, we're going to give you an extra vacation day to go do that." People feel like that can be a nice one. I do see some folks that have really large workforces doing some small financial incentives. I'll tell you that when we've surveyed employees, those don't seem real effective. Somebody that has a concern for whatever reason about vaccination, giving them $25 really doesn't change that analysis for them. So we've seen some of these other things, being a little bit more effective, like that paid day off. We'll give you another flexible day of vacation this year. Some of those types of incentives. But I think you really do have to kind of look at your workforce and those kind of creative things that encourage it. And to me, it's, let's encourage as many people to do as we can do it. If we do an incentive, let's think about something that makes sense in our workforce, and let's continue to whittle down that group. And then when we have some others, then we can get into that interactive practice and say, well, John, let's have that analysis where we need to and get that group as small as we can.
Thank you. And we'll close up with Dr. Bissell with this question. So when do you have any estimates on when the NRV might be vaccinated enough to start, and I guess the country, but when we'll start kind of getting back to some normalcy?
So, again, I've been told that the end of this month into early April that the supply is going to open up tremendously. And that's why we're really working on our logistics and our partners to really ramp up that capacity to administer it as quickly as we can. Both the state and the federal government have come out and said that they want everyone who wants and needs it to be able to be vaccinated by the end of May. So that's really not that far away. So we are very hopeful that by this summer, we will be back to some semblance of normalcy. The whole idea of vaccination is to acquire that herd immunity. What that means is less circulating virus, right? The virus has less hosts to infect. And then if it can infect the host, it can't be transmitted. So, the numbers vary. Is it 70%? Is it 75%? We definitely want to get a substantial number of our population vaccinated. And our goal is by the end of May, so that by this summer, we will be back to some normal type activity. Some of it, I will say, though, we really want to stick with the hand washing. I have stats that the hand washing was awful before the whole pandemic. And that's how things get that's communicable disease when people don't wash their hands. So I hope that sticks and that we continue to wash our hands frequently and pay attention to that and using hand sanitizer. The masks, I do hope that people don't throw them away completely. If we have a bad flu season, it's not a bad idea to maybe practice some distancing and some masking to get us over that hump, because we have to remember, we were lucky this year that we didn't have a bad flu season. And part of that is all the precautions that people were taking. We have to remember, even with a vaccine, that, flu still kills tens of thousands of Americans every year on average. So if we have a bad flu season, these are things that we have in our toolbox that we could really help decrease the cost of that flu season.
All right. Thank you. And with that, I'd like to thank you both for taking time to spend with us today. And not only today, but the work that you're doing both behind the scenes to, get people vaccinated and keep employers going in the region to make sure that, our region is set up to be economically viable. So thank you both for today. Do want to make sure that you're both going to get a gift from us. We're going to deliver those to you tomorrow from the Orange Bandana with some goodies from around the region. And before we close, I'd like to thank ServPro again for sponsoring the event today. And we'll end on that note, and hopefully we'll actually see some people in person as early as June with our next event, but to be determined. But I hope everybody has a good rest of their day, and thank you again for supporting Onward New River Valley.
Thank you.
Thanks, everyone.